In 1989, we had the first case of HIV, positive HIV case detected on the island of Saba. And with that, of course, with the population being rather uneducated about the topic or the disease itself, there was a whole issue and fear factor associated with HIV. At that time, HIV equaled death. People did not know about transmission, so there was just imagine the panic mode on the island, on this little island, that the individual that was diagnosed as being HIV positive was suddenly being shunned and thrown out.
When this actually happened, nobody on the island actually knew or had an inkling about this disease and the terrible consequences it could have. So we banded together, as I said, and we formed a group where we could actually speak with and counsel the ones who were affected by it.
So in 1990, we got together a group, and then we started to bring the ones that were infected to Curacao, and there some medication was given.
Well, of course, the medical, the doctors helped, but again, they didn't know anything either. The medication that came in was not of a proper caliber, and the ones who were taking it were getting quite sick from it. And so it wasn't really helping, it was helping them to get sicker.
And I mean, say, at that time, it was a death sentence. I mean, say, if you were told you were HIV positive back then, there was nothing there that told you that you will be living, you know, a longer life or anything. It was like a death sentence. That was it for you. And I guess people didn't feel then, why should I even try to live? I mean, see, they bury themselves, I guess, more in alcohol and drugs, and yeah, shorten their lives even more. Of course, we had also a buddy system that we tried to help each other, so we would know, you know, who were infected from who weren't, because we also try to guide each other. Oh, make sure you take your medication at this time and all of those things. So that's also very important, a part of, you know, when the virus came out, because I mean, see, with AZT, you had to take it at 9 in the evening, 12 midnight, 3 in the morning, 6 in the morning. So it was a very rigorous, you know, therapy to be on.
It proved to be a good move because the ones who were so terribly affected had somebody or people who cared about them to get them through this terrible ordeal. Instead of having people cross the street and walk on the other side to avoid them, they now had friends who could deal with the problem and help them through it. Eventually, there were more people who knew more about the disease who came forward and joined the group and assisted the medical care and getting the proper medication, finally. But in the meantime, we had lost several people.
My partner, I think about 1991, he became very confused and didn't really, I think he wasn't all the way there. So maybe he had some problem, maybe toxoplasmosis. That's what I think. It was never diagnosed, but that's what I think, because there was things that he did that he didn't know that he had done. So we hospitalized him, and of course, the nurses at the time also didn't know much about the virus. So I took it upon myself, and I stood to his side for about a month. He would be there, and I would sit on the couch and be there for him, you know, for a whole month while he was there. And then for Christmas, I decided, well, you know, he's ill, might as well, maybe this might be the last Christmas, so let's bring him out, see friends and family who were accepted and who, you know, were strong for us. And then also I had another cousin who was positive at the time, so I could not stay off my job anymore because, of course, I took a month off to take care of him. So then while I would work, then my cousin would stay home with him and take care of him. And then in February, he got very ill again, so I had to put him back in the hospital, and then he passed away in 1992.